I'm Dr. Abimbola Aina-Mumuney. I'm a maternal fetal medicine specialist, and I work here at the Center for Maternal Fetal Medicine at Howard County. If you're overweight and considering a pregnancy, I think the best thing to do is to go in and speak with your primary care physician or come in and speak with us in maternal fetal medicine. There are degrees to obesity, and the more severe the obesity, the more difficult a pregnancy can be. If you are overweight and you can calculate something called your body mass index, basically by knowing your height and your weight, and there are many applications online that you can use to check, but ideal is to be below 25. Many women in this country particularly are not below 25 for their BMI, as it's called. And so many women fall in that 25 to 30 range, which is overweight but not obese. For those women, increasing exercise, watching their diet would probably be sufficient. So obesity in pregnancy can affect both mom and baby. For mom, the risks to being obese starting off the pregnancy are an increased risk for diabetes or high blood sugar, an increased risk for blood pressure issues, particularly high blood pressure, and a condition called preeclampsia, which involves high blood pressure with protein in the urine. That can sometimes lead to a preterm delivery because mom has gotten very sick. And so we would prefer that moms have worked on their weight before getting pregnant. For baby, the risks of maternal obesity are that babies can be very small in size. They also could be very large, but we see the small babies more often. And the babies are at risk for stillbirth, particularly late in the pregnancy. We don't have a good explanation for why this happens, but it seems to occur in larger moms. And so the more that we can control it from the beginning, the better off we are. So in order to manage the risks of obesity, if you've gotten pregnant and you find yourself in this situation, what we ask is that you come in so that you can speak with a nutritionist, so that we can follow your diet closely, so we can monitor you for any signs of diabetes, so we can keep a close eye on baby's size by doing ultrasounds a little bit more frequently than the average pregnant woman. And also, we often monitor our moms that have a BMI greater than 40 at the very end of the pregnancy by doing non-stress tests and fluid evaluations of the baby, just to keep an eye and try and identify those babies that would do better on the outside. So if you are obese and you're thinking about becoming pregnant, we welcome you to come in and speak with us before getting pregnant. What we would do for you is assess your weight and possible risks to the pregnancy, discuss those with you on an individual basis, and help you get set up with a nutritionist, maybe with a weight loss plan, an exercise program to help you lose weight before becoming pregnant. And then we would be able to follow you closely once you became pregnant.